November 5th, 2009. To the Honorable James H. Douglas from Joint Statement by Vermont Psychiatric Survivors, Disability Rights Vermont, formerly Vermont PNA, Vermont Center for Independent Living, Vermont Association for Mental Health, Vermont State Hospital Workers, Vermont Coalition for Disability Rights, Another Way Incorporated, National Alliance of Mental Illness Vermont, National Association of Social Workers Vermont, Mental Health Law Project of Vermont Legal Aid, Vermont Psychological Association, Representative Warren Kitzmiller, Representative Ann Donahue, Representative Paul Poirier, Representative Mary Cooper. The Vermont State Hospital Canteen has been serving patients, visitors, and staff for over 4 decades. Last month, the Department of Mental Health announced that as part of planned budget cuts, the canteen would close on December 5th. We opposed the planned closing of the canteen and asked that this decision be revisited. The canteen is integral to the quality of life for patients and significant to the quality of care they receive. It is also vital in reducing the pressures on the hospital wards by providing a positive incentive and a humanizing and integrated setting where patients can get away from the crowded, volatile ward environment. It is a place where patients can meet with visitors off the ward, and for some patients, the canteen has also provided vocational training. In the past 7 years, the hospital has become an increasingly restrictive setting as patients have lost access to the gym, the library, the hideaway, which is an off-ward social space, and Father Loeb's camp in Duxbury. Now the state is taking away the only place patients have left outside the confines of the secure area. Cutting costs is the stated reason for closing the canteen, but at one time it was reportedly breaking even, and it might do so again. Just how much would be saved is open to question. What would be lost is clearer. Regardless of whether the canteen is considered directly connected with patient care, its loss would have a serious negative impact on that care, on the living and work environment in the state hospital. We urge the administration to reconsider the planned closing and to maintain this unique and valuable service. My name is Malcolm Sawyer. I have been to the state hospital twice. Sometimes while there, I wonder if my life was over. The canteen was the only place that made me feel all right. Being at the canteen gave me hope that one day I might return to the real world. Without the canteen, my stay at the hospital would have been really hard to get through. I can't believe there's even being thought to close it down. I think the only sane move would be to keep it open. I implore whoever is responsible, don't get rid of this canteen.
My name is Joe Yoder. I'm a psychiatric technician at the state hospital. I've been doing this job for a little over 7 years. Even though I don't like speaking in public, I feel compelled to come down here because people there can't speak for themselves. They can't even get out here. And it's just pitiful to me. The canteen would be closed down. I'm not going to repeat everything the gentleman before me just said, but I would just like to mention that I've seen all these places closed down since I've worked there. The hideaway, Father Luke's camp, the gym. We used to have a ping pong room, a weight room, the library. I guess I said that. I go to work every day. I watch them put a new slate on all the roofs of the state office compound. There's a brand new building going up behind the state police office. It's a 3-story building, something to do with a lab, with a nice new sidewalk down in front of the state police. They're putting new windows in Lawson Hall, and they've done its other buildings before that this summer. It's like, what are our priorities? You know, that's all I got to say.
Hi, my name is Sarah Launderville. I'm the Executive Director of the Vermont Center for Independent Living, a cross-disability rights organization. I also have a psychiatric disability and have spent a lot of time locked up on psychiatric wards in different hospitals. Hospital life is hard living. You're told what to do, when to do it, and how to do it. You're given different types of drugs to help stabilize you or make you fit into society. I was made to feel like a prisoner when I was supposed to be receiving treatment. I'd done nothing wrong. I acquired my disability at age 5 after surviving serious abuse at the hands of a family member. In the hospital, laying in what is called a quiet room, this is a place where the hospital administration puts you so they don't hear you. I would sob and think, why was I being punished? Locked on a ward, given medication that made me feel out of it, and have little contact with doctors that were overseeing my care. As people with disabilities, we understand what treatment works and doesn't because we have lived it firsthand. This issue affects not only us, but our families and our communities. The sooner someone is able to live outside the restricted environment of a hospital or an institution, the sooner our communities benefit. If I had not been given the proper treatment I eventually received, like time off the ward, taking walks or visiting with family and friends, and other types of therapies besides seclusion, restraints, and medications, I would not stand before you today a grown woman who has a master's degree, a full-time job, and a family of my own. The most successful types of treatment I received are the types of treatments being stripped by the administration. Over the past years, patients at the Vermont State Hospital have lost access to the gym, library, and other social settings. The canteen is the last straw. By closing the canteen, patients are restricted to confined areas and not taught skills to return to living outside a confined ward. According to the Vermont Department of Mental Health's website, quote, "The Vermont State Hospital task is to help patients achieve the stability and return to their home communities as soon as possible. By stripping away services, it will take longer for people living at the state hospital to return to their lives outside of the hospital, costing the state more in the end and costing our communities a great loss. The Vermont Center for Independent Living joins with this coalition in strongly urging the administration to reconsider this serious cut." Thank you.
My name is Kurt Sinclair. I work at the hospital. I've been a patient at the hospital. I'd like to say to the governor and the administration that most people incarcerated in the Vermont State Hospital have not. My name is Kurt Sinclair. I work at the hospital. I've been a patient at the hospital. I'd like to say to the governor and the administration that most people incarcerated in the Vermont State Hospital have not been convicted of any crime. They are locked up there because they're considered to be mentally ill. They're kept there for indefinite periods, unlike convicted criminals who have set sentence lengths. You know what it's like being locked up without even a release date to look forward to. In the past, patients at the hospital had areas off the ward where they could go. They've lost all of these over the years. Now they're losing their canteen. This is the last place they have. When you take this, they will have nothing. I speak from my own personal experience being a patient at the hospital. Time spent in the canteen is the only freedom they have. It's the one place a patient can go and not feel like he's locked up in a psych hospital. Patients should not be treated like prisoners. They deserve and need time to get away from a locked and stressful ward. The canteen is the only area of vocational rehabilitation and occupational therapy the hospital has now, especially important for people who are confined for a long period. I was in that situation years ago, fighting for my right not to be forcibly medicated. I was allowed to work in the canteen as a patient for most of my 2-year incarceration. That's the only part of the Vermont State Hospital that helped me. It also allowed me to prove that I could function without being medicated. In the end, I was able to win that battle and get discharged without being drugged against my will. If it had not been for the canteen program, I do not know what would have happened. We've had a lot of other patients work in the canteen over the years, and it's helped them too. Please do not take this away from them. It's all they have left. Thank you.
I'm Mike Saban. I work at the canteen as a patient representative. I'm also the parent of a former, my son spent a year there. I think that's basically how I would put it. I called my son last night about closing the canteen, and he was like, "I love that place. That's where we meet people. That's like, it's the only place you can go, especially in the winter time. You can't go outside, it's too cold." A brief statement here that I wrote. If I can find my glasses. When I told my son last night that the canteen was supposed to close, he replied, "I love the canteen. That's where people meet, especially when it's too cold to go outside." The canteen has proven itself to be a vital place for patients. As a former patient commented, it is an oasis of informality. For long-term patients, it is an important adjustment to the real world. The patients, I also work at the hospital as a patient representative, so I get to ask people what they felt about the closing of the canteen. And I have spoken with patients, and they are all upset about the news of the canteen closing. Eliminating it would be disheartening, demoralizing, and dehumanizing. A couple of days ago, a recently admitted patient said to me that he was looking forward to visiting the canteen. I hope that in the future, patients will have that option. And I was criticized a little bit this morning for not having a lot of succinct comments from patients, but most people I asked how they felt about closing the canteen, you generally get things like it's crazy, it's stupid, it's unreal, it's like I can't believe it, where do people have to go? So there's only so many times you can say that, but everybody says that. Nobody agrees, staff or patients, that